All right. Hey, y'all. Hey, welcome, welcome, welcome. Welcome back to another episode of our birth stories. So, listen, y'all, this is our eighth episode. I'm so excited about it because this is the first um, professional series that we're doing. So, this is where I want to bring on professionals to kind of talk about anything in the area of pregnancy, childbirth, motherhood, and all of those things. So I'm excited because today I have my friend. And you know what? Before I even introduce her or say her name or bring her up, I just want to say, like, it's really like a blessing to be able to have professionals in your immediate circle who can give you information, advice, who can just kind of guide you in the right direction. Because, oftentimes we're talking about, and the reason this whole birth stories series came about was because there were so many complications and unanswered questions and things that we experienced as Black moms that we just didn't understand. So when you're able to kind of sit with a professional, somebody you trust, somebody who has been in the field and have a passion for the field, it just hit different, right? And so I'm happy to be able to have my friend here because she has been in this field for, I don't even know how long. It's been a long, long time, but she has been in this field for a long time. I know plenty of people who can vouch for the type of service she provides. And it's kind of like one of those things where, it's like a good feeling just to know, like, we got somebody who look like us, somebody who young like us, somebody who take their art and their craft seriously, right? And they're very knowledgeable. Like, it bring you some sense of comfort and some sense of peace. So to be able to have a professional series is like a big deal because I didn't only want it to be where we just sharing our gripes, and it's by no means, in no means are we wanting to like scare people about childbirth, because that's not what this is about. It's really supposed to be informational. It's really supposed to be able to empower our community to be able to not only just talk about what's happening and talk about what's going on with them, but just to be informational and educational as well. So I think the professional series is very fitting, and I'm just glad to be able to be comfortable enough to sit with my friend and just talk about these things, just having open dialogue. So I wanted y'all to drop in the chat any questions you might have, because we definitely want to ask. Like, this is like a live professional, so we want to ask questions. We want to get more information, and this is also a means to just empower us to be able to advocate for ourselves, because once we have this information, like, we need to be able to speak up and say, like, this is what I learned, this is what I know, so I need to be able to receive a specific type of care. So with that being said, before she comes up, like, this been my friend for a long time, and that's another blessing too. We went to college together. That's where we met. Go Bulls. We didn't share a dorm. We lived in the same dorm building our sophomore year, and we've been friends ever since. And so that's been a long time, y'all. So I am so happy to just say, like, if you look in a dictionary and see, like, Jane of all trades, like, my friend is that. Okay, like, she is, like, she does everything, she is everything, and she good at what she does. So without further ado, I want to bring her up because, of course, I want to let her introduce herself. I want her to talk about what she does, and just kind of tell us who she is. And then we can get into the series. So, y'all, I'm going to bring my friend up, Dr. Katrevia Campbell, and I'm going to let her introduce herself. So, hey, friend, can you hear me?
I can hear you. Can you hear me?
Okay, perfect. Yes, yes. I see you with the pink and green background. Y'all share
Mhm.
So, in case you didn't know, that pink and green is absolutely for her sorority. So, friend, I call her Trevi, right? But y'all need to call her Doctor, okay? Because she worked for them credentials, okay? So, Dr. Katrevia Campbell. Hey, friend, welcome to the series, and thank you for agreeing to be a part of it. And I'm glad that you like the first the first professional that we having on. Like I already said, like just somebody I know I could trust. So just being able to present people with a person that they can trust, and especially if they're in the South Florida area, they have an opportunity to know like where you at and just kind of reach out to you if they need, if they need services. So introduce yourself, tell us what you do, talk to us about like, tell us about your profession.
So no pressure being the first professional, right?
No pressure, no pressure.
So my name is Dr. Katrevia Campbell. I am a nurse practitioner, so an advanced registered nurse practitioner here in Miami, Florida. My specialty is midwifery, so I am a certified nurse midwife. I have a doctorate degree in nursing. I've been in the nursing field since 2007. I've been an advanced practice nurse since 2013. I am a active midwife. I deliver in hospital at both Palmetto General Hospital and Memorial Hospital Miramar. And then I do all full scope gynecology. So I have an office setting in North Miami Beach where I see everybody from young girls from the age of 14, 15, all the way to menopause and end of life. So anything female, women's health related. There's a big misconception that midwives only deliver babies, and that is untrue. As a certified nurse midwife, I do all gynecology. So routine visits, pap smears, STI screenings, problem visits, vaginitis visits, pregnancy, childbirth, menopause, you name it, I do it. And that's a little bit about the field.
Okay, so you already dropped knowledge because that was one of my questions. I was going to ask you to like kind of specify what a midwife does. So you kind of answered that question off the bat. Um, Tell me, okay, before we even get started, I want to kind of just start with the personal side before we go into the professional side. And that's only because I want to be able to tie in like how did you use your personal experience to kind of influence or impact your professional choice to become a midwife. So talk to us about like growing up, right? Like what was it like? Because obviously, how long did you know that you wanted to be a midwife? Was that something that you wanted to be growing up, or did that come later?
So I knew I wanted to be in the medical field from very early. I mean, I remember all of like the little career days from elementary school, and I was dressed in scrubs and with a stethoscope. So I knew from very, very, very early that I wanted to be in the medical field. And so I am a first generational college graduate. I was raised by a single mother. My father was incarcerated for 22 years. And I just knew that I wanted to make a difference for my family. And so I went to private school most of my life. I went to the Miami Northwest Senior High School.
Yeah, girl, we ain't finna go there. Okay.
I was in the medical magnet program at Northwestern. And so that kind of like all of my studies kind of put me into the direction of medicine. I didn't necessarily know exactly what field, but I kind of had an idea that I wanted to either be with pregnant women or children, but I hadn't kind of honed that in yet. But for my senior year in high school, my best friend had a baby. And I was there with her when she had her baby and witnessed, that was the first time that I witnessed childbirth. And I said, oh, yeah, that's what I'm going to do. And so I went to college. I graduated high school at 16, went to college at 16. First, I went pre-med major, but then the realistic side of things, I knew I wanted something that was going to give me a little bit more work-life balance. And so I pivoted into the nursing field, and that's how my degrees are in nursing.
Okay, got it, got it. So, growing up, knowing that you wanted to be in the medical field, was there a lot of conversation, or do you remember having conversations about childbirth? Do you remember having conversations about pregnancy? Like, what was your experience with just family settings? Like, was it ever a conversation?
So my family's a little peculiar, as you know, Fatia. My sister passed away from sickle cell anemia. And so that was a part of our whole life. And you get sickle cell anemia through your parents. And so my parents' birth stories was discussed with us because my mother was very adamant about educating us on sickle cell anemia so we didn't be in the same situation that she was. So her story was young mom, 17, got pregnant, She knew she had a sickle cell trait, had no knowledge of my father's sickle cell status. Went to the doctor for the pregnancy and was urged to terminate the pregnancy because they both had sickle cell trait. And
Mm.
so I ended up not having sickle cell anemia, but my sister did. So that was something that we kind of talked about. So it's a little peculiar because we had health issues in the family. So I knew, my mom's story with me. I knew my sister was an emergency C-section. I knew all of those things, but I want to say it was because of that, aspect of things.
Mm-hmm. Um, so did you have like what were your feelings just knowing, like having that conversation about childbirth and about having sickle cell trait? What was your thought process about giving birth and having babies? Did you want to have kids? And did you have like a thought or idea in your mind about what that would be like?
So for me, it was scary because I knew that, and whenever that situation came apart, I did not want my child to be affected with sickle cell anemia. So that, kind of shed light on it. So it was always, making sure I was on some type of contraception, this, that, and the third. And then when I got to the place um, that I was kind of ready, or I don't know if we were ever ready because my first child wasn't planned, but it was always kind of in the back of
Story of
my
our life.
mind, like making sure that, we didn't continue the disease in our family.
Got you. Got you. So moving forward to, because okay, when you had Malik, when you had your first baby, look, I'm trying to keep it professional. So when you had your first child, when you got pregnant with your first child, did you have Malik before you got into the medical field, or?
The next year. So I was already a nurse when I had him. So
Okay.
I was an OBGYN nurse in the hospital at the time.
Okay. So when you got pregnant the first time, um, did you have any birthing plans, or was there anything in place? Because I know by you already being in the field, you kind of already privy to some information. But did you have a birthing plan, or was there some type of plan in place?
I actually didn't have a birthing plan because typically hospital birth is more medicalized and you tend not to have birthing plans. And so, as a nurse in the setting, it wasn't something common. So, I just relied on my coworkers at the time to try and keep me safe. I know I vetted out the different doctors at the facility to make sure that I went with somebody that I knew would be safe and would give me the type of care that I wanted and type of care that I needed. But as far as an actual plan, I would say no. I was much younger. I was very new in the field. Like, funny story, I actually had just started working like maybe 2 months when I found out I'm pregnant. I'm like, I
Oh,
just
wow.
got a job. These people gonna fire me. Like, this was not in the cards. Like, it was just a lot. But yeah, I mean, everything worked out, but I know I definitely relied on like some older nurses because when you're a labor and delivery nurse, like you're the eyes and ears. So you really can see like what doctors practice well, what doctors don't. Like, don't go to him. He's
Mm.
okay. She's okay. So I really relied on the expertise of my colleagues to like kind of steer me in the direction of somewhere that I knew I would be safe.
Got you, got you. So tell us about that journey. So you got pregnant. What was your experience like during your pregnancy? Do you feel like your experience was, I mean, just knowing what you know now, was your first pregnancy normal? Would you consider it? Like, did you have tell us about that experience.
So my pregnancies are typically complicated with gestational diabetes, so they tend to be a little on the higher risk side. I just remember with my first pregnancy being very nervous, being very scared. I remember being in labor and like watching my baby's like fetal heart monitor the whole time. Like, it's hard when you're in the field because you know everything.
Mm.
So that was very nerve wracking for me. So I remember like just watching the strip the whole time, like, when I wanted my epidural, I'm like, what anesthesia's on call? Like, that was, a lot. So it didn't really allow me to be just a pregnant mom. And then it was even worse the second time around. So 12 years later, I have baby number two. And now I'm actually a midwife delivering babies. So now I
Mhm.
really know the field. And so I've been going to a midwife provider for years, like as my gynecologist, and she's up in Boca, and she's a woman of color as well. And I knew this time around that I just wanted to be a pregnant mom. I did not want to be a midwife. I did not want to be worrying about is my baby growing or, I just wanted to be a pregnant mom. So I went somewhere that I trusted my provider 100% so
Mm,
that I could just enjoy being pregnant.
yeah. That's understandable, right? Because even when I think about therapy, and it's always like, well, who the therapists go to when they need therapy, right? So it's like, who? When you said that, I'm like, so wait, you mean to tell me you wasn't trying to like do no home birth, deliver your own baby, everything that a lot of like we see a lot more often now, where people are like home and their husbands delivering their kids, and like, was that ever like a thought for you, like? Was it ever like a outside of the hospital? Was that ever like a thought for you?
No, if a birth center was an option, then potentially, but there's not a lot of birth centers here in South Florida. Um, I'm one of those women that, and my second baby was completely natural. I did have a plan for the second delivery. My plan was to do hydrotherapy. I did hypnobirthing. I was planning for aromatherapy. Like, I definitely wanted all the things natural, but I also know that things can happen. And so it makes me feel more safe being in somewhat of a controlled environment. That way, we're going to hope that everything goes normally. But if something does happen, I'm in a place where we have everything at hand and not having to worry about, transfer to the hospital and, just not having equipment and things that you need for the outcomes. So I I know that there's a whole home birth um, field there, and typically those are done by licensed midwives, a tad bit different. We still deliver babies, but for me, I deliver in the hospital setting for that same reason. I just like it's always one of those things like if you need it, you'll have it. But
Yeah,
it's just one of those things that just makes me feel more comfortable as a provider, and also when I was pregnant.
absolutely. So somebody in the chat, well, Mika, hey Meek, she said, what is hypnobirthing?
So hypnobirthing is a type of kind of on the lines of like I know everybody probably heard of like Lamaze classes or things like that, but it's really kind of like just brain control, like very much like meditation, affirmations, like you have your tracks, you listen to your tracks, they walk you through it, like the contractions here, breathe through it, it's almost done, you're strong, you can do this, you're made for this, and just to get you in, it's to zen you out because labor is painful, but
Mhm.
you our human body isn't technically able to think about multiple things at one time. And so if all you can think about is pain, that's all you're going to think about. But if you're training yourself to focus on something else, then it's
Mhm.
going to help you be able to cope with that better. So hypnobirthing is just a way to focus on, you know, the natural part of delivery and not focusing so much on the pain associated with it.
Got you, got you. So that being said, with your second birth, right? Um, so when you had a mom, were you able, godly, were you able to have like a natural, was it a natural normal pregnancy? Like what was the, tell us about it.
So again, I'm always like, so this time I was borderline diabetic, but I still treated myself as being diabetic. So in that aspect of things, that part was abnormal. So it doesn't really fall in the lines of normal. But as far as my delivery, it couldn't get any more normal than that. 50 minutes in the hospital, my whole plan I had planned went out the window. Didn't have time for nothing. The boy was ready to get here. I couldn't even
It was ready.
I could not even get my mind focused. It was like and he's still the same way now. The boy is
Hmm.
a guy of his own self. So I remember like we just getting into the hospital, like I probably had started having contractions not even an hour before. Again, I was delivered in Boca, so it was about a 40-minute ride. And I remember signing in and my water broke. And from there, it was like, yeah, 50 minutes from the time I walked in the hospital to
That's
the time.
quick though.
Yeah, but so the water birth ain't happened. None of this. They were still trying to get an idea in my arm, like so the plan that I had, didn't work out that way, but I still
Yeah,
got the natural delivery that I wanted. So, and in retrospect, everything happened just the way that it was supposed to.
got you, got you. So I'm just crying because I just remember you talking about Amir the other day when I seen you, and you was just like, he be on the go. So that is he living up to the way that he came into this world for
From
real.
the very moment. From the very moment.
Look, we talk about he was like, no ma'am, like get me out of here.
Very much so. Very much so.
Okay, so go I want to kind of dip into the profession really quick. So I know that your second childbirth, you were obviously like way more knowledgeable. You had more information, you had more experience. So why did you opt for, because you said you have a midwife, right? So why did you opt for a midwife versus an obstetrician? But also just kind of tell us what the difference is.
Okay, so again, as certified nurse midwife, I do everything that an obstetrician does minus C-section. So the whole prenatal care, the delivery, recovery, suturing, all of that stuff, a certified nurse midwife is able to do. The difference is our field of study is a little different. So in same line in nursing and in advanced practice nursing, we're taught the normalcies of the human body. We're not taught from a pathology standpoint. We're
Mhm.
taught from a normal standpoint, and we view pregnancy as normal. And so we tend to have less interventions, more natural labors. We're just more on the natural side of things. Whereas a lot of times you have physicians and they're ruling out pathology. Like I know a lot of times it's rule out this and rule out that versus we have normal with an exception to normal. And
Got you.
so I wanted to be normal. I knew my body can do it. I had delivered naturally before. And I just wanted somebody with the same mindset that I have. Like I view pregnancy as normal. And if things fall outside of the normal realm, okay, well, there's things that we can do for that. But pregnancy is a state of normalcy, and women are made to have babies. And
Hmm.
that's pretty much the gist of things. And so I wanted a provider that thinks and practices like me. And so my midwife actually trained me. So who's better?
Oh yeah. Oh yeah. That worked out perfect. And that, you know what, that just put me in the mind frame of like everything we do in life. It always start with the way that we frame it, right? So if you already frame a situation like it's not normal, or if you frame it from a sickness type of standpoint, then you already kind of starting off behind the behind the starting line, you know what I mean?
Mhm.
Versus like you said, when you view it as normal, right, and you already have like a plan for normal, then you starting off right, like everything that you do from the beginning, right, is care and preventative versus like now we gotta try to backtrack and do all this stuff. So I like that about midwives. I had a midwife too, and I guess I didn't, thinking back, I didn't really know, like, I just knew midwives did things more naturally, but I couldn't really articulate like, this is how they view things or this is how they do different things. I just knew like, oh, midwives do things more naturally. And I guess that was the plan. I wanted a natural birth. So I guess thinking back, maybe I did have like this preconceived notion about OBGY or like obstetricians because I guess the thought was like they don't do things naturally, you know what I mean? So I'm just saying that for like the general public out there who, may not know the specific difference, but that there is a difference, you know what I mean? So thinking about that, you have a midwife for yourself, but also as a midwife, do you find that a lot of women prefer having a midwife, or do you see like a lot of people they really don't mind, or how do you, from your professional standpoint, what do you normally see?
I think they don't know who we are and what we do. And I think you hear midwife and you immediately tie it to home birth. And you have some people that go, I don't want to deliver at home. And so for them, they may completely X midwife out of the equation. And so I appreciate you for having this platform just to educate people on what it is that we do. So having a midwife is pretty much like the best of both worlds, right? So we know all the medical stuff, we know the medical side of things, but I'm gonna sit down, I'm gonna talk to you. I'm gonna say, Tia, what is it that you want? Like, what are your desires for your pregnancy? You know, you're the spearheader of this. I'm just like a tour guide. Like, I'm here to like let you know what you should be doing or not, but ultimately the plans are up to you.
I love that.
And even just in the office setting, right? So you'll come and you'll have a visit with the midwife slash I'm a nurse practitioner. So this, fits in for nurse practitioners as well. You tend to, have the time, like you don't feel as rushed. A lot of times you go to the doctor's office, they got 5 minutes. Hey, how you doing? They're out of the room. One of my biggest pet peeves when I walk into the room with my patients is they're already laid back in stirrups. It's like, no, I want to meet you first. Like,
Yeah.
can you sit up, introduce yourself? Like,
That part, for real. Oh my God.
but we're so accustomed to the wham bam, thank you, ma'am, of
Mhm.
gynecology that it's uncommon. You don't know. Oh, no, I want to know about you. I want to know more about you because our bodies are one thing. Like our reproductive system is not separate from our mental, and our mental is not separate from cardiovascular. Everything is one whole thing. So if I don't know about who you are as a whole, who you are as a person, what is your family, makeup? Do you have sexual trauma? What, all of these things that will guide the way that I'm able to help you. These are things that we can only have through conversation, not through a checklist that you write down when you're doing your medical history questionnaire that a lot of times you just don't even look through it. And
Mhm.
so I feel like a lot of people just don't know what it is that we do. People don't know that you can have a midwife and deliver in the hospital. So here's the thing about home births. In the state of Florida, licensed midwives cannot deliver in the hospital. And
Mhm.
so if you were to have a home birth and something happened and your care needed to be transferred to the hospital, your midwife cannot go with you. So then you end up being transferred to whatever emergency physician or emergency team is in the hospital. Or if that midwife does have a relationship with a doctor, then you'll be transferred to them, but they're not able to care for you there. So that's what I meant about the best of both worlds. So I deliver in hospitals. So you get to have the natural side of what a midwife brings and the comfort of having a hospital as well. And so,
Mhm.
a lot of people just don't know that part of what we do.
So I know you, okay, in your actual practice, you deliver in the hospital. Has there ever been requests for you to deliver like at home or in a birthing center? Like, does the patient choose the place or they go where you at?
Well, in my practice, they go where I am. I don't deliver at home and I don't deliver in birth center. And a lot of it is malpractice related. The state of Florida, we're the highest. We have
Mm,
the highest cases of medical malpractice.
wow.
And so it's more so of a malpractice issue. And if you, with your malpractice, if you tell them you're delivering in that house, they're gonna triple your, they're gonna triple your malpractice. That you know,
Yep. Know
but
how I go.
it's a little peculiar for me because since I came from bedside nursing and I have seen, you know, emergencies and things like that, that's just never been a goal of mine professionally to deliver at home. But I know that there's a space for that, and I know that home births are successful, and I believe in it. It's just not in my professional role.
Got you. So when we speak about like dealing with women, so this series is specifically focused on Black women. So in that demographic that you, or part of the demographic that you serve, I would assume would be a lot of Black women. Would you say that?
Yes.
Do you find that there are more high risk situations in the population that you serve? And if so, like how does a midwife navigate through like high risk pregnancies? And what is a high risk pregnancy? Let's start there.
So you have a couple of different things what could make your pregnancy high risk, but just in the grand scheme of things, anything that falls outside of normal. So even being overweight makes you high risk.
Mm,
So high BMI, older moms. I know in the series, I've been watching the series, you've had women talking about being pregnant later, so over 35, that makes you high risk. Having high blood pressure makes you high risk. Diabetes makes you high risk. Thyroid problems make you high risk. So there's a lot of different things that make you high risk. But in my field, um, we tend to like collaborate care. So all of my patients see a maternal fetal medicine specialist during their pregnancy. And that's where we co-manage. So I'm more on the natural side, but anything that becomes medical, I just co-manage it with a specialist. Whether that be if the patient already have an endocrinologist that follows their diabetes, things like that. So I just co-manage it, alongside a specialist.
Got you. So that does mean like are you that means that you're still the primary
Right,
the primary for or the primary care person, but they have somebody as a backup
right,
basically.
right.
Okay,
Or we
got
have a team. It becomes a
you.
team. Yeah,
Okay,
team-based approach.
got you. So in this, as you start to see like more Black women coming to midwives for care or coming to you for care, is there a concern like when I know we start off with the normal, right? Like we already view pregnancy as normal, but if you start to identify that a woman could potentially be high risk, and I know you co-manage, but what then does a midwife, is there like a different route that you would take as far as the care for a woman who may fall outside of the normal?
Right. So when you become high risk for certain things, so say if you're diabetic in pregnancy, right? So
Mhm.
guidelines says with diabetes that you should not pass 40 weeks, 39 if you're on medications, depending on what type of medications. So typically in a normal situation, induction is, I don't do inductions unless you're over a week past your due date. But when you're in a high risk situation, now we might have to talk about induction and things like that for the safety of both mom and both baby. So that's where things would kind of be a little bit different, because typically midwives we're typically low intervention, but when we have a high risk situation, that kind of changes things a little bit.
Got you, got you. And so flipping back to like planning pregnancies, because I know that's kind of been a thing too over the series where we talk about like women who want to plan pregnancy. So as a midwife, do you take part in like the pregnancy journey? Like, is that something that you can also help women with if they want to plan prior to getting pregnant?
100%. So like we talked in the beginning, I do care all gynecology care. So that doesn't start at pregnancy unless you only start your care with me at pregnancy. So typically when you're coming in for your annual GYN checkups, we're talking about that. Like, when are you planning to have a baby? What do we need to do? Let's get 20 pounds down. Let's get this blood pressure under control. Let's fix diet. Let's start
Love
exercising.
that.
Let's do your vitamins. Let's do all of these things. And one good thing that COVID had was that it has made people more health conscious. But I'll be honest, as a culture, health is typically not on our top priority list. So a lot of times you come into these situations like, how you know you're high risk if you don't know, right? So
Mhm.
if you haven't been to any type of healthcare provider in 5 years, how do you know if you have high blood pressure?
Yeah.
You don't know. And so, like I said, we're starting to get a little more health conscious. We're starting to have these dialogues. We're starting to have these talks. But I feel like still as a culture, we need to make health a priority, so that it's known that when African Americans, different diseases that we get, we tend to die sooner. And why is it? Because a lot of times we don't even go to the doctor until we feel like something's wrong. We're already behind the ball. And so it's just important, and even in the space, like I hear, a lot of people say, oh, I've been to this provider, I don't like them, or, they're whatever, they weren't satisfied with the care. And I feel like as, you know, an African American or anybody, you owe yourself that due diligence to find a team of providers that work for you, that fit for
Mhm.
you. They may look like you, they may not, but I mean, if we go to McDonald's today and we didn't like the food, we're not gonna say we're not gonna ever go to
You're
McDonald's
not
again.
gonna,
Like,
that's
that's
that's true.
just not. And so I see a lot of times, like, because we're starting to want to have providers that look like us, and I read comments that go, "Oh, just because they black don't mean they good." No, it doesn't. But I mean, it good doesn't have a color, right? So
Yeah.
you can go to an African American provider and they could be good or bad. Same that you can go to a provider of any race or ethnicity
Mhm.
and they may be good or bad. But our culture are known to knock everybody down from one
Mhm.
bad incident, right? So, oh no,
Mhm.
I went to this provider and they wasn't good, so I'm not going to no more black people. And it's like, yeah, why we like that?
No, right, and that's true because when I seen that whenever, not to like throw nobody under the bus, but it's like basically is like common news. So when we were talking, Dr. Jackie from Married to Medicine, and how, all this stuff came out about her, and how, comments she made or whatever. And then it's like this influx of people like, well, that's why I don't deal with it. And it's like, okay, this is one person. Like, you can't judge everybody off of that one person, right? And not to like disregard anybody feeling they gonna do what they want to do. But the main point is that don't lack care for yourself just because this one person mistreated or mishandled or didn't, match your standards. You know what I'm saying?
Right.
So I think that was more or less the point I want to drive home, especially for us. It's like, just because you didn't like an experience in this place don't mean that you neglect yourself. You need to still, like you said, do your due diligence and find you somebody else who gonna take good care of you, because we need to take care of ourselves. And speaking to that, when we think about like planning pregnancies or planning like what do we call, like family care or family
Family
planning,
planning. Mm-hmm.
family planning. So when we're in those stages, is there like a protocol that you would typically give a patient if they're, besides the medical, like, do you dive into like the mental health component? Do you discuss like the sickle cell like trait type of thing? Because I know like that's also something you advocate for. So are all of these things discussed in like in the meetings that you have with your families?
Yeah, 100%. We go from top to bottom, and try and identify risk factors that could, potentially become an issue. So, past history of depression. We know once you put those hormones of pregnancy, in it, I know that's been a revolving theme in your series as well, talking about depression and things like that, which is a whole nother, area that we don't believe in as African Americans.
Mhm.
But, again, that's also changing now. Like, you are seeing more, people of color that are, going to therapy and, making it more commonplace. But you just go through your list of things. So, like I said, if you have a past history of depression, yeah, maybe we probably need to go ahead and start getting our therapist back, having your regular sessions. That way, when you add the hormones of pregnancy in, it's not this complete wave of, like emotions and, just mental dysregulation, because
Mhm.
like we know how it is, even when we're on our cycle. Like, don't
Yeah.
talk to me like you very moody. So just
Very.
imagine being on your cycle for 42 weeks. Like,
Yeah.
that's pregnancy. And so, if you have some, certain pre-existing things or even just family history, like, so
Mhm.
that, like you said, with a sickle cell, you start going over like family history things. Like, do you have a family history of diabetes? Do you have a family history of hypertension? Okay, well, we definitely need to start cutting back our salt intake and definitely need to start instituting, water and exercise and things like that,
Mhm.
just to kind of, it also just gives the space, because there's certain things that are beyond our control, right? No matter
Mhm.
how prepared for what it is, but it just opens the dialogue and opens the area for education. And that's another big thing that midwives and nurse practitioners, we are very big on education. I give you the information on what you do with it. I'm not there to decipher what you do with it, but I'm going to sit and talk to you. You're going to understand what's going on. When you come to my office and you have something, you're going to leave knowing exactly what's going on. And that way, even if you never see me again, you will never be in a space where you don't know what's going on with you again.
Yeah.
And so I'm very big on that. And that opens that arena to just start talking about it.
Absolutely. Mika say, "Come on, Campbell cares." And Melanie, "Hey, boo." She said she loved it. She said, "Hey," but you can see the comments, right?
Mm-hmm. Hi,
Okay, okay, okay.
congratulations on the baby.
Yes. So now I think, going back to like just you being pretty much like a pioneer in this space, because you like the first midwife that I know personally, at least. Um, I've known that you deliver some, matter of fact, you deliver my cousin baby and like so many babies in our community alone. Like you like the celebrity midwife. So does it change the profession at all when you have like a personal relationship with the women who you care for?
It makes it more nerve wracking, but y'all will never know that. because right, you're going into this with somebody you actually care about, and not to say you don't care about all of your patients, but it's different, right? You have relationships with
Mhm.
these people, and so like I said earlier, like we're not in control of everything, and so I'm always like, all right, got you through the pregnancy, got this baby out, thank God, because if something goes wrong, that would be something on me, right? So now it's a
Mhm.
personal thing. So
Yeah.
it's always kind of nerve wracking, being responsible, right? Because I'm the one that's
Mhm.
responsible at this point. But it also makes me feel good knowing all of, like, I go to the family reunions and I see all of the babies I delivered, right? And it makes me feel good for one to know that people trust me in that space, and for two to know that I care a lot about what I do to do everything in my power. Because
Yeah.
there's certain things that are beyond my control, but to do
Mhm.
everything in my power to get you through these healthy pregnancies, to get these babies born, to have healthy babies, to get you breastfeeding,
Oh,
all of
that's
the
a big
things.
deal. We need to get a breast. I don't know what they call them.
A lactation consultant. I
Yes,
have a
lactation
lactation
consultant.
consultant. Yeah.
Or two. Are you a certified lactation consultant
I'm
as
not,
well?
but I have one that would be probably be
Okay.
a good person.
Okay, perfect. Because we need to talk.
Yeah.
Hey cousin, this is my cousin Tiffany. So she had a baby and she used a doula and a midwife. So I want to touch on that too.
Mhm.
We might go a little bit over hour. I'm not sure,
Oh
but let's
yeah,
see
I
if
ain't got
we
nothing. Like the toddler in there with his granddad, we okay.
okay, good. So tell me the difference between a doula and a midwife, and do you work with doulas?
Okay, so a doula is a support person. They are there
Okay.
solely for the birthing family. So as a midwife and as a practicing midwife, I would love to be in the hospital from the time you get there to the time that you deliver. But I also probably have 35 patients in the office that's waiting for me. So sometimes it's just not realistic, right?
Mm-hmm.
So the doula steps in to be that support person that's there for you the entire time. They're
Okay.
knowledgeable about pregnancy and birth because they're around pregnancy and birth, but they're not a medical professional. And so they
Got
can give you advice because they've been in hundreds of deliveries. They've seen what went wrong. They have a field of study. So they're knowledgeable about everything, but they're not a medical professional. And so the same way you have your OB doing delivering, I'm in the same lines of that. So it's a little bit different. Again, a doula is a great addition to a birth team because it keeps mom focused. They know the intent, they know mom's birth plan, they know what mom wants, they know what mom desires because these are conversations that they've had. And so they can relay those to the nursing staff and the hospital staff when mom's in pain and not able to articulate exactly what it is that she wants. They're that person that's there solely for mom.
got you. Got you. Do you find that you work with a lot of well, not do you work with a lot of doulas, but do you find that a lot of doulas are now present with your patients? Is it like a growing trend? Do you see now happening?
It's a growing trend, but I know that they're probably more in the home birth setting.
Mm,
Yeah, I
got you.
see them, but they're not as common in the hospital setting because typically doulas are with moms who deliver naturally. And it's still a misconception that women that deliver in the hospital are medicalized, right? That everybody gets epidurals, and that's not true. Those things are not true. But again, back to educating on where I am, what I do. A lot of people don't know that. So, um, yeah, you have women that wanted to be on the more natural side. Those would be your patients that typically have doulas.
Got you. Got you. So would you say like in just touching on the doulas, would you say like a high risk patient, would you recommend that they have a doula? Is it still necessary in a higher risk setting, especially if doulas are, I guess, more commonly supportive during like the natural setting, which or normal or natural setting? Like, are they? Would you say like they are needed in high risk settings as well?
Absolutely. Absolutely. Because again, they're there for the family. So, again, regardless of the situation is high risk, you still have wants and desires and wishes for your pregnancy. You still are in pain. They're there to help you with, your breathing and your relaxation and, your mental focus. So absolutely 100%.
Got you, got you. So going into I guess I want to tap into like we talked a lot about the prenatal depression and then like postpartum depression, have you seen that often in the population that you serve?
100%.
Okay.
Yeah.
And usually in those situations, like, is it like is it a psychiatrist that you may refer to, or is there like something that you all do as midwives to like kind of intervene in those situations?
Well, we do a lot of education on our side, but I like to send them to the professionals. So I'll send them to a psychologist. I have colleagues, nurse practitioners that are in the psychology realm. I like to send them, especially in pregnancy, because like I said, postpartum depression is definitely serious. It's very common, and you need that support, right? You need that team, and you need people that are experts in their field, right? So I'm an expert in what I do, but then you have experts in psychology and experts in different things. And for me, I want to go to the best. So I, typically refer them to a psychologist, not necessarily a psychiatrist, because a lot of times it's just, giving you those techniques. Like you're having a bad day, like, how do I get through this? What are my coping mechanisms? What are my coping strategies, meditation, things like that. So they may not necessarily need a psychiatrist, but at least a psychologist.
Okay, got you, got you. So moving into like the postpartum side of things, after the woman delivers the baby, like what role does a midwife play post baby?
So
What is it that you
we go
typically
back
do?
to gynecology. Remember, this is full circle. So, unless you only elect to go for the pregnancy, then you continue your gynecology care, with me until you go through menopause and leave earth.
That's the whole life cycle, pretty much.
The
But you
whole
said that at first.
Yeah, the whole life cycle. But yeah, you come back for your postpartum stuff. We do, breastfeeding support. You're having issues with latching. You come in, I'll help you latch, things like that. But typically, once you're, adapted to being a mom, then you just switch back to your regular gynecology care.
Got you. But which can still be the midwife.
100%.
Got you. And so post baby, what would you say is like a protocol or standard of care for women who for follow up, like after they given birth? What is the next step as far as follow up is concerned? Like, is there anything that you're looking for post birth? Are there like any markers for mom, not necessarily baby, but for mom? Are there like any markers or things that you're looking for after the mom gives birth?
So the biggest things and the biggest, I guess, conditions or problems that happen post delivery is preeclampsia or hypertension. So those are things that I definitely talk about. You can get preeclampsia well into your postpartum period, and so my patients are typically educated during the pregnancy of the signs and symptoms that you're looking for that. Definitely, if they are high risk, then there's a different kind of plan in place for that. But we talk about, the headache, the blurred vision, the facial swelling, just not really feeling well, spots floating in front of your eyes, pain in your right upper quadrant. We talk about all of those things that, are not normal, or even
Mhm.
like back to breast. So, you have breast issues. So mastitis, like we talk about that, like when you need to come back, okay, you have a fever, your breast is hard, it's in pain, it's very uncomfortable to breastfeed, you need to go back, to your
Mhm.
provider. So these are all things that, we talk about and are always available to our patients for anything that falls outside of normal. And I typically, when my patients leave the hospital, I typically tell them, like, if you feel like something not right, you come see me.
Come see. Yes, I want to touch on that for real because a lot of things that we've talked about over the course, not only over the course of this series, but just in general, you hear all the time about how a lot of black moms will say, "Well, I told my provider this, and they didn't, like they just told me, oh, it was normal," or "I told my provider that, and they just sent me home." Like, do you experience women who have like certain complaints, and when they have complaints, like how do you normally deal with those things?
We talk everything through. I'll be honest. Our It's a little difficult for us because we're also competing against Dr. Google and Dr. TikTok. And so,
Right.
there can be a plethora of false information, just, even just looking at different things from social media, right? It's different from a personal perspective and a professional perspective. And
Mm-hmm.
so there can be a lot of false information that is out there. And so some things that you're complaining about, they might be normal, but Google said it's not. And so a lot
Yeah.
of times they don't even trust their medical professionals enough because, they have other ideas of, what's going on.
Mm-hmm.
It's just important to have somebody you trust, point blank, hands down. Like,
Mm-hmm.
you have a provider that you trust, you have a provider that if you bring something up to them, they're going to hear you, they're going to understand, they're going to sympathize with what you have going on. And I might tell you it's normal, but I'm going to also tell you that I'm sorry you're feeling that way, and I'm going to educate you on why it's normal and educate you on when it's not normal anymore. And so, yeah, it's all in just, being able and being comfortable and being in that space where you're not rushed to actually talk about what's going on in your body.
Mm-hmm. Got you. Got you. Um, if you knew then what you know now about just pregnancy, childbirth, planning, family planning, motherhood, like first, would you change anything about your own personal experience? And two, is there are there things that you would incorporate into your profession now, like the way that you handle your patients or do things now as a medical professional?
Well, this probably gonna go off on a tangent because I'm a whole soapbox about this 6-week abortion ban. So,
Oh, okay. We talked about that briefly on another one. Yes. Go
so
ahead. Go in, friend.
um, build relationships, go to your annuals, go to your yearlies, have these talks, talk about what's normal, talk about what's not normal, talk about what's in the cards for you in the next year, talk about what's not in the cards for you in the next year. Talk about what just makes sense for you, what makes sense for your life
Hmm.
in the realm of health. Um, Talk about the stuff you're embarrassed about and find
Yeah.
somebody that you trust enough to say, yeah, that you really shouldn't be embarrassed about that because that's real common.
Mhm.
It's not that big of a deal. Like, um, I don't know. I'm kind of dope, so I don't know if I would change anything differently.
Come on, friend. You are.
Google
You
me,
are.
baby, for real. Like, no, seriously, I don't know. I'm really big on just making people feel comfortable. So I don't know if I would change anything really.
Got you. Got you. And we ain't got to, right? Because we can't change it anyway if we wanted to. But um, when you think about just the Black women that come to see you and that you care for, and that you just encounter, like what is a piece of advice personally and professionally that you would give Black women or Black mamas that's like embarking on a journey of motherhood and pregnancy? Like what's one piece of advice, or you could give more than one piece, but what would you say to them professionally and personally?
I guess this falls for both, but stop putting everybody else as a priority over yourself. Because if
That's
you're
real.
not, in the best of who you can be, you can't be anything for anybody else. And a lot of times, right, we're all moms and we put everybody over us, right? From the husbands to the children to our jobs to the million things that pull us in a million, different directions. Self care is very important. And even if it's just 30 minutes, like if I got 30 minutes on my lunch break, I'm going to get me a foot massage because that gets me relaxed.
That part.
Like just making ourselves the priority because
Mhm.
there's so many people that rely on us and so many things that rely on us, but if you're not your best self, you can't be good for anybody.
Hmm. That is absolutely true. I just wanted to tap in on what Tiffany said about dealing with postpartum psychosis and having to see a psychiatrist. So we backtracking, but I do want to touch on it. When have you ever experienced any? What was your most extreme like case of pregnancy? When I mean, and I'm just saying like anything that was outside of the normal that seemed to be like a first time you dealt with it, or it was just a really difficult case that you learned something from. Like have you had any of those experiences?
Mm. That's kind of hard to say because I've been doing this for like 13 years. So I've seen a lot of stuff, but I'll tap on the postpartum psychosis thing. Um, that is a conversation that you keep the family involved, and whoever the support people are, for the patient, whether it be her spouse or her mom or her sister. I tend to have those conversations with them. Like, if you're noticing things are off, you might need to pick up the phone and call me yourself, because postpartum psychosis is different than postpartum depression.
Mhm.
Most women that's in postpartum psychosis, they don't know. They
Yeah.
really don't know. And you'll see, these things on the news, right? Of like situations with moms and, detrimental things that happen to their kids. And 9 times out of 10, they were in postpartum psychosis. They ain't know. They weren't themselves. And
Yeah.
so, you need those people around you to really go, yeah, doc, something not right. Like, she's staying in her room. She don't want to be around the baby, and that,
Yeah.
what prompt that, yeah, we need to execute a different level of care.
Got you. Absolutely. We didn't really touch on like support systems here. So like when we think about like the families, whether it's the husband or whoever else is a part of that support system, how in touch are you with them? Like, do you find that you include them in the care often, or it's just really the responsibility of the patient to include their support system?
No, 100%. Like, my spouses, they have to come with questions. It's not all about the mom. So when they're in there, like, if you don't have a question today, next visit, I need a question from you. It's all like they need to be, involved, because we don't get pregnant by ourselves as women, and it should not be the responsibilities of us as ourselves to take care of
Yeah.
everything. And once you start instituting those support people from early on, then they'll be more apt to help you after you have
Mhm.
the baby when you need it, right?
Yeah.
So, one of the risk factors for postpartum depression is lack of support and lack of sleep. And if you don't have a support person, you're not sleeping. And
Mhm.
so, we have those talks of, yes, you're going to want to be mama bear, but use the support people that you have. Give that baby to that daddy for 2 hours
Mhm.
and come on, lock your door and take
That part.
a sleep. Like, and the baby will be fine when you wake up.
Uh-huh.
And
Yep.
are things that, people just don't know, So lack of sleep is one of the highest risk factors for postpartum depression, because if you're tired, you just can't function. And
Yeah.
so really having that support person, if I have patients that they have their moms, and hey, get mama to stay for the first 2 weeks. That
Yeah.
way, and it's a blessing when you do have those support people. But a lot of times I find that people, and especially we're talking about, so now you have more professional people that were waiting until later in our lives to have babies, and our thinking patterns are different, and we feel like we should be able to do everything ourselves, and we don't want people in our business, or we don't want
Mhm.
to, rely on people. And that's just not realistic. Like, it takes a
Yeah.
village, and it's different now. Like, mothering feels different, and I always kind of say, like, well, how did our grandparents have 12 kids? And the difference was they had community, right? So they
Yeah.
stayed in communities, they stayed in close quarters, where auntie down the street, that's not your auntie, but auntie is responsible for making sure
Yeah.
that kids got in the house. And it was more of a community, where now it just seems like you're doing everything by yourself, because the
Yeah.
nearest auntie lived 15 minutes away.
Yeah.
And it makes it really difficult. So it's important for our mental health to rely on the support systems that we have.
Absolutely. That's real powerful. And I think about that too, even in my own situation where and you was there. So it was kind of like, girl, I was so glad. I was like, oh, and daddy, listen, okay, A1, because because although I had like extra support too, but the fact that he was there and he was able to be present and keep her for as long as I was like down, like that is super important. And I always say that whenever I'm like sharing or talking to people, like them daddies is like they priority too. They need to be stuck like glue, because at the end of the day, like you say, we didn't create the babies by ourselves, but is just as much of an experience for him. So, him being there is important. And so having that community and that village, that always send me back to just my own personal birth story and just how many people was involved and how many people were available and willing. Like willing is another thing too, like just people being willing to be a part of that village and assist when you need it the most. And that's like one of the most vulnerable times, whether it's whether you have difficulties or not, like it's still a vulnerable time.
Yeah.
So
And
yeah,
I'll tap back to your previous question that you asked. What was something that I saw that kind of changed maybe the way that I practice?
mhm.
And it was before I practiced, but I will say it was your story.
Mm,
And at the time when you had Aya, I was in midwifery school. And because of everything that, I witnessed and saw through you, that made education about preeclampsia a priority for me and my patients. And so I will say that you have impacted my field in that aspect because, yeah, it was some days I'm like, listen, y'all stop texting me because I just, like, your situation was so outlandish that it was at a point, because again, I'm in the field, right? So I'm like, yeah, I don't know if it's going to pull through this. And
yeah.
there was times that it was like, okay, yes. So in my power, I have to make sure in the arena that I am, that won't happen to none of my people. And I can't say that anything would have changed. I don't know the medical background of everything that you went through outside of just what I know as being your friend. But I was like, what? Like LFT 7,000? What? Like, no. And so, those are all things that, like, even if it might not be, but the little smallest little sense of like, let's watch her.
Yeah.
And I will say that was from the experience that I had with you.
Dang, like that's I mean, it's a blessing and it's like, dang, like that's crazy. But I'm glad though, because like I say, just even having somebody a part of your immediate circle who, you know, who is in the field and who is knowledgeable and who have like not only like the life experience but the education to match. Because I think that was something that I thought about was how the doctors kept saying, like, we never seen nothing like this, and it was just like, well, damn, am I alien? Like, what's up? But, having somebody who's not only did you witness it, you know what I mean, but you've also had your own children and, you've been in the field for a long time and, you've gone to school for this, you're educated, like, all of those things play a part, I'm sure, in the way that you provide care. So I know like your patients get like the optimal care because of all of those things. And so I'm kind of grateful for that you were able to see like I guess one of the worst or one of the most extreme things happen. So like, okay, let me make sure because I know that it can happen, even though we don't want it to happen, and we're gonna try to prevent it from
Yeah.
happening. Um, so before we start to wrap, I want to just give you an opportunity to just tell people where they can find you, tell them, everything that you're involved in, what you have coming up. Because also, y'all, listen, if you need like a midwife or you need maternal, what can we call? I mean, I know your official term is midwife, but maternal health care or maternal
I'm a
health.
nurse practitioner. I'm an OBGYN nurse practitioner.
Okay,
So
so
that covers pretty much everything that I do. Yeah.
got you.
Yeah.
So tell people where they can like find you, what you got coming up, and so people know where they can get some great care.
So the easiest way to find me is Google me, Katrevia Campbell, and Google. You can find all the details. I'm in North Miami Beach. I pretty much accept all insurances. Off 167th and Northeast 19th. I do a little bit, a lot of the things. I got t-shirt businesses and weight loss stuff. That's at www.campbellcareshealth.com. I am one of the co-founders of a sickle cell anemia foundation nonprofit. We have some things coming up. We have our health fair that's coming up in June. So if anybody wants more information in this health sector, that will be a good place to come. We'll be giving out a lot of different information about just how to make ourselves healthier, how to make our communities healthier, how to make our children healthier. And then if you're just looking for somebody that looks like you, like I am, I'm the type of provider that I'm very like down to earth with you. I'll tell you, I just had a patient the other day that was having a miscarriage, and that's
Mhm.
a tough situation. And I just kind of started the conversation with, me too, sis. I had one too. And a lot of times we don't talk, right? And so a lot of times you feel like you're the only person in the entire world that's going through certain situations. And I find that God has put me in certain situations, and you probably could say the same, Fatia, to be able to have these conversations as just an eyewitness of, I've been through the same things you've been through, and you'll get through it, and just to develop that support system where it's like, yeah, because if Dr. Campbell did it, like I could do it. Like,
Mhm.
if you got through this, I know I can too, and
Absolutely.
my patients, they know my stories. They know, things, because it just makes it makes me a person. And so they're
Yeah.
more apt to hear the things that I'm telling them to keep them as healthy as they can, because they understand, like, I gotta do these same things as you. Like, ma'am, I don't like my pamphlets done either, but we gotta do it. But we like so, and we really like, have these conversations, and just very in a non-judgmental, just, look, this what's going on in my life, and this what I need help navigating. And I ain't gonna tell you, like, don't do it. I'm gonna tell you how to do it the right way.
I like that you said that because I'm always like, advocate for yourself, speak up, say that's something I just kind of picked up because I wasn't always like that. But then, of course, it's like, if you don't know, you don't know, that's a whole nother thing. But like, ever since everything happened to me, it's kind of like I learned how to like speak up because, at the end of the day, the doctor don't know what you feeling, the doctor don't know what you thinking if you don't tell them, or the provider don't know unless you say something, you know what I mean? So I'm really big on that, like, just say something, just speak up, because you are the person who's experiencing it. But more than that, like, you need to be spearheading your own care, or if you're not able to do it, always have somebody who can, like that support system,
Mhm.
somebody who can do that. But it's so much stuff we ain't touch on because now I want to go back real quick and just talk real quick about um when you going back to the sickle cell thing, right? Like when we're talking about um, like just advising women on how to um move forward with planning their pregnancies. Like when you find that there is a patient who may have sickle cell trait or may have sickle cell anemia or any other chronic illness,
Mhm.
like are there like different tools that you can give them to help them like navigate pregnancy easier? Because I know like chronic illness is a whole different ball game. So when you're talking about like trying to manage symptoms of that and pregnancy, like are there specific tools that you give them, or like is there like a standard of I guess like a standard way to like move forward in a pregnancy?
Okay, so that was kind of a loaded question. So sickle cell, in the same lines of like thalassemia, cystic fibrosis, those are things that are genetic, right? So
Hmm.
it's important to know just your health history, like to know what traits you have, to know different things that you could potentially pass on to a baby. And then those would be things that would be important when you're vetting a partner, right? Or trying to
Mm,
decide, are we going to have a family, build our family? Is it going to be a natural family? Are we going to go through IVF to make sure that our babies are healthy? So these are all conversations that you should have before the game, not after.
after.
Not
Right.
after we're already pregnant.
Mm,
So um, with my last child, again, there's a big gap between my children, but shortly after my sister passed away, I was in a pretty newer relationship, and it was like, yeah, pause, go get tested, because if my partner had a sickle cell trait, we were early enough in the relationship that I might have said, this ain't gonna work.
yeah.
And that would be because I knew that I wanted to expand my family, right? And so
Hmm.
these are things that you need to know, right? So you need to know before you are sexually active with somebody. You need to know their STD breakdown. You need to know,
Yeah.
are you exposing yourself to diseases and to HIV? And that would be the same way you would vet. Yeah, that's not gonna work for me.
Yep.
But you can't do that unless you know your own, medical history. So you would need to go to your provider like, hey, you know what, I'm thinking about having kids. Like, I want to have kids. Can we run a panel? Can we see what traits I have? Can we see what I could potentially need to be on the lookout for, or things that might become an issue, down the
Mhm.
road? Those would be some of the questions that, you would want to ask. And
Yeah.
then I guess the second part of your question was, when you do have these things like the high blood pressure, diabetes, just being in the healthiest of that realm that you can
Gotcha.
be, right? So making sure your sugars are under top control. So if that means that when you're not pregnant, you might still try to have a little ice cream because I could just take my insulin and it'll be okay. But that's not going to fly when you're
Yeah.
pregnant. So now already changing those habits of like, okay, I need my vessel to be as healthy as it can be, for when I decide to get pregnant. And the same with the high blood pressure. Like, yep, because that oxtail ain't gonna work because it's got too much salt in it. So let me start to change up and blend up my diet so that I can
Mhm.
be as healthy as I can be in the constraints that I have.
Got you. And that's so like, oh my goodness. And when I think about like how we would that fall under like preventative care, so to speak?
100%.
Okay, so like I think we talked about this on another episode where we was just like, yeah, we don't talk about nothing when we just be in love, girl. We don't care. We just be like, we just let's do this, right? But it's so true. And I never forget, shout out to Miss Corinthia, your mom, because that was the first time I ever heard somebody say that. Like when she mentioned, I don't know what we was doing. We probably was somewhere doing something, I'm not sure, but she mentioned that yeah, you need to know if your partner got sickle cell trait because otherwise you never know what can happen, especially if you have the trait. And that's what really prompted me. I didn't know I had sickle cell trait until I got pregnant. And maybe my mom mentioned it because I think my mom had a trait too, but my daddy didn't, if I'm not mistaken. And so now I had a trait, but I like that wasn't something we talked about. Obviously, I didn't know that until I got pregnant.
Because the doctors tell your mom, oh, it's not a big deal. And so your mom
Hmm.
may or may not tell you it's a big deal. But my children gonna tell you different, because if you have a conversation with Malik is going to tell you, I have a sickle cell trait and my partner cannot, because he knows.
Yeah.
And that is the mission of our organization, to prevent sickle cell. And of course, if you have somebody with the disease, it's a different type of love. But if they was never here, you would never even know them, right?
Right.
So from the prevention aspect, so back to just a little bit of knowledge about what you said. So if you have two parents with sickle cell trait, you have 25% chance that the child will have disease, 50% that the child will have a trait, 25% chance that the child will be normal. And so,
Mm,
and that's with any type of genetic thing that is autosomal recessive, meaning you're going to get them from both parents. Both of your parents have to have the trait for there to even be chance of disease.
got you.
And then some people might still want to gamble it and say, you know what, well, I still have a 75% chance that they won't have it. But another misconception is that, okay, there's a 25% chance that my baby can have said disease, which means that if I have four kids, maybe one of them will have it. No, there's 25% chance in each pregnancy. You
Got
can very well have four children and they all have disease, because when you are conceiving, it's the luck of the dice. It's the luck of what you give off to that offspring when we're taking mom's chromosomes and dad's chromosomes and putting them together. And
you.
so that is something that for somebody they may want to take that risk, but for somebody else they may say, you know what, yeah.
Yeah.
And for us, living with somebody with sickle cell, my sister had a hard 23-year life. And so for me, I wouldn't want to bring a child in
Right.
with that possibility. And so that goes back to just knowing, like, even like, so all of our events that we have for our foundation, we offer sickle cell screening, genetic cancer screening, same
Mhm.
like a BRCA gene, right? So
Mhm.
you have a BRCA gene and you know that that can pass on to your children. Like, these things, you need to know what your genetic makeup, because that's
Yeah.
going to change, the way that you do things, the way that you need to be screened, how often you need to go to the doctor, how often you need your PAPs, how often you need your mammograms, that
Mhm.
changes everything. But if you're not aware of it, again, you're just rolling the dice and you're just like, well, I don't know,
Yeah.
and it's just back on, just being educated, just being aware, just knowing that things are out there, just taking the same due diligence that we do with everything else in our lives,
Mhm.
with making sure that, we got the right nail techs and the right hair
Mhm.
supplies and all of
Yep.
that. Like, just making sure that you have people that's going to steer you in the right direction. And there was another, and I don't want to hold this too long. We can talk for a long time, but
I know. I knew we was gonna go over, but it's okay.
that
It's
was
all right.
another like high profile death that I don't know. And I kind of talked about it a little bit on my social media page about, and I'm not going to get into the specifics because I don't know the medical specifics of what happened, but it was talking about cervical cancer.
I think I remember what you're talking
Yeah,
about.
and the young lady died with cervical cancer. And it was kind of like said that there was a lot of visits to the emergency room. The emergency room is not somewhere for long-term care. I just
Mhm.
want to state that you go to the emergency room is there to diagnose whatever is going on, and that's it. When you leave, 9 times out of 10, they're sending you with a discharge paper that says follow up with
I know.
such said provider within such said time, because
Mhm.
they're not there to manage what is going on.
Mhm.
They're there to diagnose you and get you out. So
Mhm.
a lot of times people will go to the emergency rooms for these recurrent issues and never follow up with the provider to really come up with a plan of care. Okay, you
Mhm.
have fibroids. What is my plan of care? If you go into the hospital just for the bleeding, they're going to give you medicine to stop your bleeding. That has nothing to do with your
Right.
plan of care. It is very, very important. If you go to the emergency room and you're diagnosed with hypertension, please find your PCP, regardless if it is a nurse practitioner, if it's a provider. You need a plan of care. And
Yeah.
that is how we fall. A lot of times we go to the emergency room, and I'll be honest, I hear the stories. You go see a doctor, you got your copay, you got your insurance, you might have a deductible. You go to the ER, they got to see you. So a lot of times people go because of that aspect,
Yeah.
and they don't go for the follow up. But it is very, very important to have providers to guide whatever you have going on. If you have whatever, lupus or
Mhm.
hydradenitis or whatever it is, the emergency room is not the place for long term
Long
care.
time. Yeah. And I know all the times I've been, they always ask, well, who is your PCP? Who is your this or who is your that? Because my PCP, and I ain't even gonna lie, not that I lack care, because I keep up with my stuff, and that's how I know for a fact. I'd be like, dang, my PCP called me before I could call them. I'm like, we heard you was in the hospital, da 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 da. And I'm just like, well, dog, give me a chance to get home and settle in. I'll get home and get settled in. But I feel like there is like, I mean, I'm not gonna say no system is perfect, but like there is like some things in place that can help us kind of stay on course or stay on track. But it is our responsibility to make sure that we following up and we getting the proper care and we making sure that we stand on top of the things that will keep us healthy and stand on top of the things that's going to help us manage whatever it is that we're dealing with. And so that is the encouragement, y'all. Like that's the call to action. Like if you have, whether you have chronic illness or not, it don't matter about what illness you have or don't have. It's about you being able to create access for long-term care, right? And if you have insurance, if you have or shoot, what happened if you ain't got insurance, friend?
A lot of times they have self pay. A lot of offices have
Okay, okay.
different self pay visits. And again, you probably don't want to pay, $400 to see the doctor, right?
Mm-hmm.
I paid $400 to get my hair done.
You got a point. That's true. That's true.
And I'm
It's
gonna leave
true.
it at that.
Yeah, yeah, that's true. We have to prioritize, and that's the thing. You only get one life, you only get one body, and it's up to you how it's up to us how we take care of it. You know what I mean? Oh, me say that post made me go to get a pelvic exam and found out I actually have 3 small fibroids. That is like true. Like, a lot of times you will learn about certain things that you didn't know before because you don't went to the emergency room or and they located something. But now what do you do after that? That means you have to find you a provider that's gonna help you kind of navigate that, which leads me to my next question about fibroids, because we didn't touch on fibroids. Um,
This gonna have to be a series too. Next we're gonna have to get to a
like we gonna have to like come back. Okay. Last question. We gonna wrap up, y'all. When okay, do you have a high population of women that have fibroids that come to see you?
Mhm.
Okay. Now, and this is very basic, and we gonna wrap. Is there a different standard of care for women who have fibroids? when you're talking about pregnancy?
Not really pregnancy related, no.
Okay.
I have women with huge fibroids that get pregnant. I have women with no fibroids that can't get pregnant. I have, so fibroids can interfere with pregnancy. Sometimes they can give you pain in pregnancy, and that treatment is a little bit different.
Gotcha.
We might have to treat fibroid pain in pregnancy. Sometimes, depending on the size and or location of a fibroid, it could change the way that you can deliver. So if you have a fibroid that is blocking your cervix, then you may not be able to deliver vaginally because the baby may not be able to pass underneath.
Got
So it can change care in that aspect. But just in GYN, just in general, like, if you have fibroids, you got to talk to your provider, and I have different ways of how we manage fibroids in patients.
Got you. Got you. All right, y'all. So listen, we could probably go on and on and on and on and on, but um find Dr. Campbell. We had quite a few people in the chat saying we love Dr. Campbell. Like Dr. Campbell is the truth, the best midwife. So the people going up for you, friends. So we know that you out here in the community, like really taking care of us and making sure that we good, and that's all we want, right? We want providers that care. We want providers that, I mean, obviously we want providers that look like us, but we want providers that care. Like that's the priority. And we want providers that will speak to us like human beings, that will treat us like human beings. And then also, again, just providers that we can relate to. So I appreciate you, everything that you're doing, from Shakivia Foundation to, midwifery to, just your style in general, from t-shirts to party planning to all the things. Like, you are for real like a Jane of all trades. And we appreciate you. I thank you for coming on. Y'all know where to find her. I'm gonna also put it in the caption so that way you all can contact her as well. But Google is your best friend. That's how you're gonna find her fast. So if you
4.9 reviews, 4.9 stars on
on
Google.
that 4.9 reviews, and them reviews matter because they be telling the truth in there sometimes. But most of the time they be telling the truth. So there you go. We got Trinae on the line. We got Shay on the line. We got Queenie on the line. We doing good in here. So yes. All right, friends. So we gonna wrap up. We gotta do this again. I definitely wanna do other series as well. I do want to do some other stuff and we'll talk about it, but I do want to bring you back as we keep going. So thank you for being a resource and a friend. And I will talk to you later. And I'll see the rest of y'all. We'll be back with more episodes and I'll keep y'all posted on when the next one is gonna come.
Thank
All right,
you.
friends. See you later.
Bye.